All right. It says we're live, so I'm going to believe him. Hey, welcome everybody. I'm Jeff Nelson, and today's live stream is all about your questions. We've got the questions that have been posted since yesterday afternoon, and Dr. Peter Rogers, he's here with us. Hello, Dr. Rogers.
Yeah, hey there.
And Dr. Rogers is here to tackle those questions straight, unfiltered, and in the order that they came in. If you've seen Dr. Rogers before, you know he doesn't sugarcoat anything. He gives you the truth, the science, and the practical steps that you can actually use. So thank you for submitting such great questions, though, to be honest, I haven't looked at most of them yet. Why don't we just jump right in, Peter? It's always great to have you, of course. Let me click some buttons here in order to get the right format. There it is. And get rid of that banner on the bottom. So here we are. First question: with mild CLL at age 76, is it necessary to get the seasonal flu and COVID vaccination? Also, is it necessary to eat beans, tofu, if eating purely plant-based? CLL, is that cancer? Is that
chronic lymphocytic leukemia? Yeah, so sort of a low-grade cancer. A lot of times they don't do much about it because it's so low-grade. It's sort of a turtle quite often.
Yeah. Okay. Well, there's certain things I don't really go into that much on my YouTube channel, and this part of this question is one of them. But I do have a video that John McDougall made, sort of answering this question. Maybe it wasn't for this particular person, and we're gonna run that real quick. Dr. McDougall.
I believe in vaccinations. I really do, except for two. And those are the flu vaccine and the COVID vaccines. But every time I pick up the newspaper, I find out there's a new vaccine and a new variant. That's the same as with the flu. They can't catch this virus. You know, with the flu vaccine, what they do is they make a vaccine against viruses that occurred 3 years ago or 5 years ago or 2 years ago. The same old virus doesn't seem to come through. And that's what they're doing, is they're chasing around this COVID-19. And vaccinations are a huge business. I mean, I used to be aware of the business idea when I go to the grocery store, and they told me I got 10% off my groceries if I got a vaccine, a flu vaccine. I thought, there's got to be business here. And now I see, you know, it's big business. You know, it used to be polio, Salk, Sabin. You knew they were scientists. They just did it to help humanity. Not so sure these days, are you?
Okay, there is Dr. McDougall. Anything you want to add, Peter, or you want to talk about beans and tofu?
Well, the guy asked, do you need to eat beans or tofu? There's no plant food that you need to eat. And tofu's, you know, from soy. I would never eat anything from soy. Soy, I think, is like the most overrated food on the planet.
All right. So next question is, what do you think of adding wheat germ to oatmeal?
No, I think that's a bad idea. Wheat germ is highly processed, refined, and it has a lot of PUFAs, polyunsaturated fatty acids, which have a tendency to go rancid at room temperature. When it's in the whole food, it's partially protected. When it's out in the open, all ground up like that, it's not protected. So it's probably going to be rancid. I recommend avoiding the wheat germ.
All right. Next question is, Dr. Rogers, do you have to get the flu shot because you're a doctor? I volunteer at a hospital. Can't see a way around that. Thank you. Any comment on this, or you want to jump past the medication ones?
Yeah, this is a Q&A on nutrition, you know.
So next is no question, but want you to know I love these Q&As. Thank you. Okay, what role does soluble fiber play in detoxing old toxic bile from the body?
Well, basically, you know, the more fat you eat, the more bile you have. So you're going to be more prone to getting, you know, toxic secondary bile acids. So when you eat the dietary fiber, that feeds the good bacteria, and it comes from plant foods, which are usually low in fat. So that's what you want to do. So basically, by eating a low-fat diet, you'll have less bile, you know, going down to your colon, potentially being turned into secondary bile acids. That's really what you want.
Great. So next question, why would someone get heart palpitations and lower energy when doing no salt, but then be free of those symptoms when consuming plenty of salt?
Well, you know, you got to see if you're hyponatremic or something. And is it really due to the salt? If you're worried about that, you can go to like a kidney doctor or something. They can work you up for hyponatremia, low blood sodium. If that's really the case, you know, you could you can look at it real closely. What's your blood sodium level? What's your urinary sodium level? You could categorize all your food for a couple of days and see how much sodium are you really eating. You know, people like the Yanomamo ate next to nothing for sodium. They would have like close to 0 sodium in their urine. But, you know, so maybe it is your sodium, maybe it isn't. But, you know, I would work towards figuring that out if it's causing you symptoms. I'd be worried about having heart palpitations because that could be a precursor that you're going into AFib. And you want to get that figured out right away. And there's a whole bunch of other things that can cause AFib. What I'm saying is don't just be so certain that it's from a sodium issue. It could be due to a lot of things. A lot of drugs cause AFib. There's over 100 mitochondrial inhibitors that contribute to AFib. And there's other things. All the standard chronic Western high-fat disease stuff contributes to AFib, obesity, hypertension, diabetes, and whatnot. So I would start working on that before you go into AFib because AFib, you know, is a pretty serious disease that can lead to dementia, underperfusion of the brain. It can lead to fatal arrhythmias. It's a big deal.
Peter, can you move just like 4 inches to your right or something to get you a little more in the middle of your square? That's beautiful. Next question is, what's the difference between functional medicine and lifestyle medicine?
Well, when I think about functional medicine, I sort of think about them trying to figure out the root cause. And so they'll do a lot of testing, which can cost you money, you know, all these different blood tests and allergy tests or whatever it is they're trying to test. And then they'll often treat stuff with a supplement. So it's sort of compared to conventional medicine, they've often replaced drug therapy with supplement therapy. Whereas lifestyle medicine, to some extent, sort of implies more of a holistic approach. You know, optimize your health habits. Are you exercising? Are you getting your sleep? Are you managing your stress? Are you eating the low-fat vegan diet? Are you getting your sunshine? Are you getting along with people? You know, be religious, all that stuff. So, and I actually think that's kind of the smart way to live and be, is optimize everything as much as you can. We're designed to walk around outdoors in extended family groups looking for plant foods. Okay, that's what we're designed to do. So it's good to be a minimalist. So I would recommend doing all that stuff. And then if you're still sick, then start looking for answers. But what most people do is they keep all their bad habits and they just go to the medical system and want an answer, want a pill or a supplement. And it's a lot better to optimize your health first and then go looking for all that other stuff, because it can be very expensive. And often, you know, the supplement or the drug has a side effect or a new problem or it doesn't work. So, and now you spent all this money.
Beautiful. Next question. Dr. Rogers, when you were losing weight, did you try any full day fasting along the way? What's your opinion of 36-hour versus intermittent fasting for fat loss?
Well, the big thing about fasting is the idea of the pleasure trap, you know, and that's what Doug Lyle, Alan Goldhamer write about in their book, that you sort of reset your taste buds if you fast for a couple of days, and then it makes it easier to go to eating low-fat plant foods. Because if you've been eating a lot of processed food, there's so much MSG, salt, fried food, and other chemicals in there. It adds a bit of a fancy taste, if you will, and to go to regular low-fat plant food immediately afterwards can seem kind of bland. But, you know, the bottom line is, you have to eat, and you're going to have to eat every day. So just get in the habit of eating good foods. I never did any fasting whatsoever, but I have seen people who've had some good results, especially if you're really fat and you're really addicted to a bunch of junk food, you know, or you have some special situation. I've seen good things happen for fasting. We all know they've had patients with, you know, lymph node enlargement, lymphoma reversal, people like Jeff who've lowered their LPA. So I've seen good things happen from fasting, but I'm just saying is, you know, and I eat the 1 meal a day diet, which in a sense is a little bit of a intermittent fast, if you will. But I just do it because it's convenient. I don't do it because it's the greatest thing in the world. I just like more free time, you know.
Great. All right. I'm tempted to follow advice of eating fish to help hair loss, but all the reasons not to eat it, fish, vegan, toxicity of the ocean, fat, etc. But so many people suggest fish, even a person my husband knows.
Yeah, well, anybody suggests fish means they don't know what they're talking about. Fish is just blatantly stupid. I mean, it's very high in mercury. It's high in endocrine disrupting chemicals, especially all those estrogenic chemicals. It's very, very acidic. You have all that animal protein. It's high in saturated fat. It's often fried when it's cooked. I mean, the PUFA omega-3s are often rancid. There's nothing to win with fish. There's a funny book called something like Diagnosis Mercury, something like that, by Jane Hightower, internal medicine doctor in the San Francisco area. There were all these demented yuppies and nobody knew what to do with them. They were testing their blood and their urine only for mercury. and you need to do some type of long-term chronic test, like a hair test or something, to accurately diagnose it. So they were misdiagnosed. She just told them, stop eating fish. And lots of them got better. Some of them, it was too late, but that's Jane Hightower was the internist's name. She called the cognitive decline from excessive fish eating, she called it fish fog, for brain fog. I thought that was a good one.
Wow, interesting.
Yeah, for hair loss, there's other things contribute to it. Just, the genetic side of things, like especially on the father side of the family. Lack of blood flow to the scalp can also contribute to it. Hypothyroidism can contribute to it. Nowadays, they talk about some of this red light stuff helping hairs to grow, but that's kind of like when they're already present, grow better. It's not going to take a bald head and make it into a hairy head. But those are some other things to consider.
Beautiful.
Well, one last thing I would add is you don't want to wear tight hats on your head. I had the situation like when I was a kid, my mother didn't want me using some hairbrush, boar bristles or something, and she would take them away from me. But so you don't want to brush your hair too rough or curl it too tight or put it in these tight braids where there's tension on it. That's called traction alopecia. You can get hair loss from that. You also don't want to wear tight hats. If you ever looked at your legs, if you wear socks that are maybe a little tight, they stick to your lower leg as you pull them up. You'll notice that you lose all the hair down there. So that's a type of, some type of friction alopecia, it's called, another reason to lose the hair. So you don't want to do those things.
Interesting. Okay. Next is, what would be the best treatment outside of antibiotics for SIBO?
Well, SIBO is small intestinal bacterial overgrowth, and it's almost a little bit of a controversial diagnosis. The implication is that normally the stomach acid kills most of the bacteria from the food you eat. And you'll tend to have very low bacterial levels in a small bowel, but it's normal to have obviously super high levels in the colon. And then some people postulate that if you decrease stomach acid from antacids, for example, or drinking too much alkaline water, proton pump inhibitor drugs, that you can get bacterial overgrowth in the small bowel. But it's difficult to diagnose. There's some breathalyzer test that's wrong about 50% of the time. And it's a little bit of a dangerous game to play because then they can treat it with antibiotics is what they'll often recommend. But if you don't really have it, the antibiotics will make you worse. If you do have it, the antibiotics supposedly will help get some of those bacteria out of the small bowel. It's kind of risky. There's not a good way to diagnose it. I know they can do this fancy sterile endoscopy, upper endoscopy, where they go into the second part of the small bowel, the jejunum, to try to get a sterile sample. Is it really, having excessive bacteria? So a lot of it's theoretical. And what I'm trying to say is what I recommend is when you eat plant-based diets that are high in fiber, they're intrinsically high in fiber if you're eating a plant-based diet, a low-fat plant-based diet, that feeds the good gut bacteria and it tends to improve the gut overall. If you're still having persistent chronic symptoms and you're not getting better, you can maybe go to a gastroenterologist and consider all that stuff. But SIBO, it seems to be real, but it's a little bit of a gimmick is what I'm sort of saying. And the dust hasn't settled on what exactly it is and what exactly is the best way to diagnose it and manage it.
Great. All right. Next question. I need help understanding why I still have blood results showing inflammation, even though I'm otherwise very healthy and slim, exercise daily, eat a WFPB diet. I'm having trouble with recurrent miscarriage and infertility, making it hard to get pregnant in the first place. Mostly blood work looks great. However, had mildly elevated MCV levels persistently. Most recently, another blood test revealed elevated CD19 and natural killer cell levels. I often have this sensation in my bones and joints are smoldering hot. Doctor wants me to try intralipid infusions to help with the recurrent miscarriages, but that seems counterintuitive when I know from McDougall that low fat and starch base is the way to go. Do you have any advice?
Yeah, I mean, you got multiple different things going on here. You mentioned elevated MCV, mean cell volume, like for your red blood cells, and that can suggest a big red blood cell type of anemia, megaloblastic anemia. So you can look at things like a folate deficiency, a vitamin B12 deficiency. You can consider those things. It might be mild, so mild that it's a normal variant, but infertility, there's a whole long list of things, like 20 things associated with infertility. So I would go through all that stuff first, see if that resolves the problem. And, you say you have inflammation, but what do you mean by that? Like a high sensitivity C-reactive protein elevation in your blood, elevated white blood cell count? I'm not sure what you mean. But for example, I would go through that list of things that cause infertility, and there's lots of them. Number one, do you filter your drinking water? The fluoride in there is bad for reproductive health, okay? The aluminum in typical municipal tap water is bad for reproductive health. There's sometimes other chemicals in there bad for reproductive health. Look at your diet. Are you eating organic only? There's powerful estrogenic chemicals in that non-organic food like atrazine sprayed on the corn for high fructose corn syrup. You know, it's also a mitochondria inhibitor. The glyphosate's pretty toxic stuff sprayed on the soy and about 70 other non-organic foods. So you want to make sure you're eating all organic. So that's what I'm kind of getting at, that idea of optimize your health as much as you can. And if a problem persists, then you can look at it and you can more precisely deal with it versus a lot of people, they've got 20, 30 things wrong and they want to fix it with a pill. That's just not going to happen. But that's how I would start. Go through the entire list of things that cause infertility, cause increased risk of miscarriage, solve that as best you can, and try to resolve the other issues. And then you'll probably have it more narrowed down and you'll be better able to pinpoint, you know, what's going to help you. So.
Great. Next question. What are your thoughts on getting pneumonia vaccine? Okay, we're not answering those today. Had a DEXA scan. I have osteoporosis. Doctor wants me to go on a drug. I prefer not to. What can I do instead? I work out with heavy weights 5 days a week, get in 10,000 steps a day, eat whole food, plant-based. Do not take calcium supplements, but get around 1,200 milligrams through food. Any other recommendations?
Well, it's good that you're exercising, but, you know, Dr. McDougall's given real good lectures about osteoporosis and bone density. And the point was made that it's based on the bone density of a 30-year-old woman. And she needs to carry around a lot more mineralization of her bone because, you know, the thought is that she's probably going to get pregnant. You know, before all this birth control stuff, 1960s and whatnot, women would typically have 10 babies, okay, or 10 or more babies, all right? So anyways, once you're postmenopausal, you're not having babies anymore, you don't need bone density so high. And the main thing that's going to cause a decrease in bone density is animal protein because it's acidic. It has more methionine, for example. And the sulfur-containing amino acids and cysteine are partially metabolized as sulfuric acid in the blood, and that's excreted, co-excreted, the hydrogen protons to buffer the blood pH acidity with calcium leading to calciuria, increased risk of kidney stones as well. So anyways, minimize intake of dietary protein. I recommend being 100% vegan. And there's a good chance that'll make you fine. Like the Bantu women who get almost no calcium, they don't get osteoporosis, and they have 10 kids, and they breastfeed them all for years. Dr. McDougall said he would sometimes have patients who were really refractory and high risk for osteoporosis, and in those cases, he would give those patients, you know, skin transdermal estradiol. It's an estrogen cream. It's also good to get a lot of sunshine. That's your good source of vitamin D. That's the best way to get your vitamin D is through the sunshine. It does other things besides vitamin D that are beneficial for you.
Great. Okay. How low should we keep LDL if we have atherosclerosis?
Well, I usually just go by total cholesterol, and you want to keep total cholesterol below 150 because LDL varies with the total cholesterol. People will tell you, you know, for a regular person, not a high risk person, it's good to keep your LDL below 100. They'll say if you're a high risk or you've had previous coronary artery event or something, try to keep your LDL below 70. And so I would, you know, optimize the whole low-fat vegan diet routine as much as possible, and exercise, and get your sleep, manage your stress, all that stuff, get your sunshine. And usually that's going to be good enough, you know. And I would go with that. Because a lot of people will ask me, well, do I need to take a statin? Do I need to take all these medicines? And I'm always like, you know, you don't understand. You want to fix everything you can in ways that you can control. You can control your diet. You can control how much you exercise. And if you still have a problem after all of that, then consider going to the drugs. But, you know, the average person is not scared of drugs. I'm scared of drugs. I'm not scared of exercising. I'm not scared of improving my diet. I think that's a much better long-term way to go because, you know, you're always looking at a marathon. Do you really want to be paying all that extra money for a drug? Do you really want to be driving to the pharmacy every 2 weeks?
All right. Next question from Curious Beauty. My doctor wants me to take an antidepressant that helps relax my anxiety and IBS symptoms. I've been getting a nervous stomach, upset stomach, unpredictable times. I need to use the bathroom, but I do not like the idea of taking that medication. What do you recommend instead?
Yeah, well, the great psychiatrist Bregan said that all psychiatric medications cause a lobotomy. You know, the antidepressants cause a gradual lobotomy. The antipsychotics often cause it rather rapidly. So You know, the fact that conventional medicine prescribes about 10 different medications for IBS is a good indication they don't understand it too well. I can tell you what Dr. McDougall would recommend. He'd say, put them on a low-fat vegan diet, and most of the time, in the vast majority of patients, it all goes away. He says, if you don't get better from IBS with just eating a low-fat vegan diet, McDougall diet, you know, which is basically about the same thing as the Esselstyn diet, the same thing as, you know, what Jeff Nelson eats, what I eat. Okay. Then you can eliminate wheat. You know, potentially there's a gluten issue and those issues. If you're still not better after that, then you can consider, you know, doing an elimination diet and eating, you know, for a while, primarily things like sweet potatoes, winter squash, white rice, and all that, and see how it goes, and then gradually add back other foods for, you know, about 3-4 days at a time, and see if that causes symptoms or not, and gradually, you know, build up the variety of what you can eat. And I would eat organic only. There's a lot of toxic chemicals, herbicides, pesticides on that non-organic food. So that's how I would approach it. Dr. McDougall's got newsletters on that subject. He's got testimonials of patients cured from their IBS by going down that route. And that's all just, you know, with dietary change without taking all these medicines. Because I know all the medicines they'll put you on. They'll put you on antidepressant, on Bentyl, on all this stuff. I think it's kind of insane, actually.
And McDougall has that diet listed on his website, the elimination diet. You can go look it up and try it for people that are interested. Hi, Dr. Rogers. Jeff, question about vitamin B12. No longer take cyanocobalamin based on doctor's video. Switch to methyl in a veggie cap, which I dump into a glass of water, discard the capsule. Also found adenosol, hydroxy B12 in the same capsule, which I do the same thing, alternate weeks to get benefit. The dose is 2,000 milligrams per capsule. Theoretically, a dose is taken weekly. Okay, can you read this?
Yeah, and I would just tell you about B12. You know, the question I see a lot of people asking these days is, well, you know, there's some vegans who say they don't need to take B12. And I would say, check your blood levels. If you're able to maintain your blood levels and you feel good, then good for you. You know, you may be able to get enough from the diet that you're eating. But I know for myself, mine will drift down when I'm eating a vegan diet. And I also know that, you know, you can check your B12 pretty easy. I correlated and I kind of figured out how much B12 I need to take. I like the methylcobalamin version best. You can take, you know, ingest it. You can take a sublingual version of it so you avoid all the gut issues. I don't have experience with adenosol. I would not take cyano because you know what cyano means, okay? And there was a guy by the name Joseph Chandy. He wrote an entire book about all these side effects and problems patients have when they have a low B12 level. You know, you don't just potentially get megaloblastic anemia. You can also have neurologic injury and stuff. So I'd be checking those blood levels, correlating it with your diet, get that figured out because, you know, I think it's pretty important. You know, you get folate comes from foliage like its name. So that usually resolves itself. And if it seems like you have a problem with that, you can go down that track and pursue it. But I would be safe first. And then if your levels are high, your B12, then you can wean off the supplement, and who knows, maybe you don't need it. But I wouldn't go there without knowing for sure first that your B12 levels were okay.
Yeah, I did a little experiment with my B12. When I did a test, it was a 1,200 and it was pretty high. And so I just went off for 6 months, and then I tested again. I was down around the high 300s. And I just did what you said. I just watched it when it went down, which it did. Then I started again to kick it up. All right, next one. If your diet was 100% perfect, your lifestyle 100% perfect too, and there's no room for improvement, but your LDL cholesterol was 112, your total cholesterol 170, would you consider taking statins or other medications?
Yeah, I'll address the LDL question. One last thing I forgot to mention. This guy, Chandy, was an interesting guy. He was in the England healthcare system. And he was writing about patients who, when their level would go below 400, they would become symptomatic. So he was more worried about it because some people think, you know, levels in the low 300s are okay. And maybe they are. Mine's drifted down as low as like 312, for example. But all I'm saying is, you know, be a little careful. Better safe than sorry. If you want to learn more about it, you can read that guy's book. I think his name was Joseph Chandy. It's a pretty easy book to read. But you'll see why I wouldn't just let it go without thinking about it. Okay, getting back to the LDL question. We briefly talked about LDL a moment ago. Routinely, they want you to keep it below 100. If you're a coronary artery disease patient, you know, previous MI or something, below 70. And what I'm saying is, you know, these numbers are reasonably good. Let's see, they said their LDL was 112 and their total cholesterol 170. Doctors Esselstyn and Orange, for example, said if the patients just follow the diet, if they're a little bit high on the total cholesterol, they're usually just fine. And I would probably go on that path. But it's also been my experience most of the time when the patients say they're really eating a healthy diet, they're not. You start asking them questions and they'll be eating high-fat foods and things like that. So I would look at what percentage of calories are from fat in your food. It's pretty easy, you know. Most of the starches are pretty low in fat. White rice, 1%. Sweet potatoes, regular potatoes, 1%. Lentil beans, 3%. Black beans, 4%. Garbanzo beans, 13%. Soy, like around 37 to 40%. I wouldn't eat soy. Flax, about 60% fat. I wouldn't eat that stuff. Oatmeal, quinoa. I also have trouble with that one. You know, in the ballpark of 15% fat. Yeah, quinoa. There we go. So anyways, those are really low fat. Whereas you look at any of these animal foods like salmon's 50-50, 50% fat, 50% protein. That's why you're not going to win the game of fat with animal foods. But that's what I'm saying. Just make sure you're really low in fat, because a lot of people, they think they are, but they're not. I like to keep my total fat below 10%. It's probably in the ballpark around 6 or 7% actually, or 5%. It's low.
Next question about probiotics. Some influential people in the plant-based space really pushing them. Of course, they sell them too, recommending them if you need to take antibiotics, but also anytime if, despite following a plant-based diet, you still feel wonky. But I've heard our digestive system would just render them useless before they get to small intestine. So it's just more expensive pee. Plus, I don't trust them. What if they sneak a GMO bacteria or something in there? LOL. Could they be helpful?
Yeah, I mean, pretty much analyze it. If you eat a bacteria, a lot of them are going to get killed by your stomach acid. Okay, that's number one. Probiotics are like bacteria. Number two, usually the way to win the game is, again, there's a lot of wisdom in that idea, just going back to the Bible of Genesis, okay? You know, that's what we're meant to do. Walk around outdoors eating plant foods. And I tell you that because if you just eat the plant foods, they got a lot of fiber. Fiber favors the growth of the good bacteria. There's always a competition in your gut between the good bacteria and the bad bacteria. The good bacteria feed on fiber. So if you eat the fiber, you feed the good guys, they're going to replicate and you'll have good bacteria in your gut. So that's how I approach it. I think that's the best way to approach it. That's the way Dr. McDougall would recommend as well. And that's another reason why, let's say you have IBS that we just spoke about a moment ago. You want to stick to the good diet 100% every single day. Because if you keep going back and forth, like let's say on the weekends, you know, you go eat fast food, then all that fat and that lack of fiber, it's going to favor the bad bacteria. And then there's going to be a battle in your colon for territory between the good bacteria and the bad bacteria. And you're going to get diarrhea, bloating, cramping, and all this stuff. Versus when you eat the high fiber plant diet, the low fat vegan diet every day, the good bacteria, they obtain dominance in your colon and your gut quiets down. Lots of people have had that experience as they become vegans. They might have the farts for the first 2 weeks or so, but then their gut tends to settle down and just do what it's expected to do.
Great. Next question. What would you do if you had a really high LP(a)? Would you take Repatha, PCSK9 inhibitor, not a statin? Is Repatha a mitochondrial inhibitor?
Yeah, I'm not aware of it being a mitochondrial inhibitor at all, and I've studied that subject pretty extensively. But, you know, it's a new drug, so it's going to, you know, PCSK9. It's going to get totally overhyped. And, you know, Jeff dramatically lowered his LP(a) just by going on the fast for a while over True North. I'd be like, why not just do that? You know, I would not be too eager to jump onto a new drug. Who knows what the side effects are? You know, who knows what the side effects are of, you know, theoretically a PCSK9. It facilitates maintaining more LDL receptors on the liver to sort of suck the LDL cholesterol out of the blood. But who knows what the consequences are for that? I have no idea what the long-term consequences are for that. I don't want to be the first person to find out. You know, usually it takes 10, 20, sometimes 30 years to really know what the side effects of a drug are. And almost all of them in the beginning, they're overhyped. The advantages are exaggerated and the risks are downplayed. They're not known yet.
Amen. And when I did that medically supervised water-only fast, 10-day fast up at True North, I tested again 6 months later and it was still down. I cut it down by like 43% or 44% just in that 10-day fast. And I'm due to have another test to see where I'm at. All right. So your thoughts, please, on 180 to 190 degree dry sauna 4 times a week, 20-minute session after strength training, 68-year-old vegan woman feeling good.
Well, you know, why do a man's testicles hang down? To cool them off, okay? It's not natural to be sitting inside a little room, 180, 190 degrees, okay? We know it's bad for testosterone and sperm production. Who the heck knows what that does to your brain cells, your brain enzymes? That is not a natural thing to do. I realize people can tell you they feel good after a 180, 90. I realize you go into Europe and the Northern Europe, some people really like the saunas and claim it benefits them. I would be scared of heating my body up, to 190 degrees. I realize your body temperature doesn't go up as fast. It goes up faster in a hot tub than it does in a sauna, but that's still unnaturally hot. Everybody's all scared if the baby has a fever going over 104, but then you want to sit in a room and be 180, 190 degrees. That sounds like you're taking a risk, and who the heck knows what the potential complications of for that. I don't think that's a wise idea. I'm a little bit of a chicken, and I wouldn't be sitting in that hot of a room. I'm nervous about that. I wouldn't do it.
Come over to my house. We have a sauna. All right. Next question is, I eat cooked mushrooms several times a week as a vegan breast cancer survivor for the aromatase inhibition, but I recently learned these organic mushrooms are grown on poultry litter. Ugh, also arsenic from some poultry feed stored in the feathers and thus in the mushroom growing medium. Do mushrooms take in the arsenic from growing substrate? And do us mushroom eaters then ingest arsenic or fecal bacteria? There you go.
Yeah, I know what you're talking about. The chicken farmers they give arsenic to the chicken because they get intestinal parasites, and the arsenic antibiotics help treat that pretty well. Plus, it keeps the chicken skin looking pink in the store a longer amount of time. So the poultry industry loves arsenic antibiotics. But then they sell the chicken feces to all these other farmers, including for growing wine, for growing mushrooms, and for growing rice. And that's how all this arsenic got into the food supply for those food types. With rice, I still eat rice. I'll rinse it 3 times to minimize the arsenic. But, mushrooms, they're real soft and they have a more complex shape, they might be harder to rinse. So I would be concerned about that. I've never bothered with mushrooms because they're almost like too complicated. And rice, I trust when I buy rice that it's rice. Mushrooms, there's so many different types of them, and some of them are kind of dangerous. I've never really bothered with mushrooms too much. But yeah, I would be concerned about the arsenic issue. I mean, if you have some way to reliably test it, that you can buy a brand that's healthy and low in arsenic, that would be okay. But otherwise, I would avoid it.
Great. All right. Next question. Microplastics, please share your thoughts.
Yeah, this whole microplastic stuff is kind of worrisome. There's been papers coming out where they've done autopsies and they find microplastics all over people's bodies. They find them a lot in the kidneys. The kidneys are sort of like the filtration system of the body to filter your blood. They find them in the brain. They find increased amounts in the brains of demented people. Now, the increased amount in the brains of demented people, they might have more blood-brain barrier breakdown, and the plastics just got through them. It doesn't mean the plastics are causing them. But still, you don't want to be ingesting all these microplastic particles. So what could you do? You never want to microwave anything that is stored in plastic. Like, a lot of people microwave baby bottles. Not a smart thing to do because then you leach more plastic in there. Plastic is a lot of times lipid-like. So it's especially bad. You never would want to buy an oil in a plastic container. That would be a really bad thing to do. I'll also tell you, I had a change in behavior recently because a viewer told me that they think that the water pick puts microplastics into the water that you can use for cleaning your teeth, the high pressure water to clear out the space between your teeth. So I stopped using it, but I don't know for sure if that's true, but they said they think it is because it's in a plastic container and it's pumping high pressure water through plastic tubing. And sometimes people leave the water sitting in there. So I stopped doing that. I just use plain old fashioned floss, but I don't know for sure if that's true. I would store my water in a glass bottle. Second choice would be stainless steel. I would not drink water from a plastic bottle. I wouldn't want one of those, those bottled waters. Who knows how long they've been sitting around in a warehouse or a truck with the plastic leaching into the water. What else? I would store food in the refrigerator in glass rather than in plastic. You can't completely avoid it, but those are some things you could do to minimize it. Because I do think it's probably a legitimate health problem. It just hasn't been figured out yet. I'm not thinking, what else could I think of? I would eat off glass plates. I wouldn't eat off any plastic plates or use plastic silverware. I'd vacuum the house periodically if there's plastic particles accumulating in the house. Maybe get a HEPA filter. I would definitely filter drinking water with a reverse osmosis filter in the kitchen, ideally with a whole house carbon filter. Let's see. Oh, for clothing too, I'd only wear natural fibers, which I only do. I wear cotton, preferably organic cotton, or I'll wear wool. If you got an old shirt, like let's say you have a dress shirt that might be part polyester or something, I would wear a t-shirt or even a sweatshirt underneath it. Because, again, the plastic is kind of lipid-like. Your skin is lipid-like. In biochemistry, like dissolves like. So, you swim in the water. Water's polar. It's not hydrophobic. So you don't quickly absorb 10 pounds of water. But when you rub plastic on your skin, you'll have a tendency to absorb some of it. I wouldn't use non-stick cookware. There can be like a plastic material that's associated with the fluoride polymers. It gets into your food potentially. I would avoid that. That's pretty much it.
Not my water pick. All right, let's see. Here's the next one. I've been reading Hormone Secrets since your book review on your YouTube channel. Disappointed that the author promotes high-protein diets. I'm interested in your thoughts on bioidentical hormones overall. Evidence suggests they may help prevent cardiovascular disease, osteoporosis, Alzheimer's. As a health coach, when women ask me about bioidentical hormones, I typically say they're unnecessary with a healthy diet. However, I'm reconsidering. My mother had hysterectomy in her 30s, never received hormone therapy, now has osteoporosis. Might have been prevented if her doctor recommended bioidentical hormones. What's your perspective as preventative therapy?
Yeah, there's kind of a couple questions in there. Like one thing she mentioned that her mom had a hysterectomy when she was 30 years of age. Well, women who have hysterectomies at a young age, they have increased incidence of hypertension, coronary artery disease, congestive heart failure, and dementia. As a matter of fact, if I see a demented female in the age range of let's say 45 to 60, first of all, I check the usual suspects. Are they a drinker, smoker, drug addict, alcoholic or something? And if they're not, then the first thing I think of is hysterectomy before the age of 35. There's been big studies, like over 2,000 of them, Mayo Clinic and whatnot, that women who get a hysterectomy at a young age, typically for fibroids, have a markedly increased incidence of all these Western diseases at an early age. And I think it's because they stop menstruating. When you stop menstruating, you get a higher hematocrit. Your blood becomes thicker, higher viscosity, which leads to more hypertension. Hypertension is, the number one risk factor for intracranial atherosclerosis and whatnot. So with a guy, they see their friends dropping dead of heart attack and stuff. So they start becoming careful about atherosclerosis, cholesterol level elevation in their 40s, if not in their late 30s. But a lot of times the women are totally oblivious to it. So they don't realize it until they had some strokes and whatnot. So I do think estrogen replacement would have been a good idea for her when she had her hysterectomy at 30 years of age. Maybe they didn't know. Okay, but now when she's postmenopausal, now everybody gets a little worried because if we give her estrogen replacement, is she going to have an increased incidence of breast cancer, increased incidence of uterine cancer? I can tell you, McDougall says he usually doesn't give it, but in some patients he will give it. And again, he likes the transdermal skin creams, estradiol. The bioidenticals is a big hot topic. And with the bioidentical people, and by the way, McDougall says the same thing. He does not like those pharmaceutical synthetic things like, Provera, medroxyprogesterone. He doesn't like the horse urine, Premarin. Premarin comes from pregnant mare, the horse estrogen. Bioidenticals are supposed to be the same hormone as what is in our bodies and thus safer, but the drug companies don't like them because they don't make money off them. They can't patent them. So then they're made by these compounding pharmacists, but the compounding pharmacists are in a precarious position because Big Pharma wants to put them out of business. So that can drive up the prices, that they make life difficult for them. How good is their quality control? I don't know. But I know that's a hot subject. So if you want to go down that path, I would try to find somebody who knows a lot about that. You might find a gynae doctor who specializes in that, or an endocrinologist who specializes in that, because it gets very tricky. And I do also think, there's a lot of games are played in the medical business because there's so much money at stake. There's billions of dollars at stake. I'll just tell you one situation I had. This was about, 10 years ago or something, 15 years ago. I was sitting in this conference and they were talking about an end-stage cancer patient with end-stage cachexia, wasting. And they said, well, we really wish the patient could gain some weight and could gain some muscle mass. and we're not sure what to do. We're considering, total parenteral nutrition, TPN. And I said, why don't you give the guy some anabolic steroids? And they all looked at me like I was some type of heretic jerk. They go, no one does that. And I'm like, well, why not? I know a lot of college football players, when they want to get big and strong, gain weight and gain muscle, they take anabolic testosterone steroids, okay? Why don't you do that? And they're like, well, that's not in the protocol, that no one's ever advocated that. And I'm like, well, why not look into it? I was sort of visiting the conference. I'm not related to the oncology service at all, but that's kind of the point I'm making. I think that there's been a bit of a demonization of testosterone, anabolic steroids in older people, in part because, if these old guys are feeling strong and virile, they wouldn't want to take all these other pills. And so I think they've exaggerated the amount of coronary artery disease related to testosterone, because there's a lot of logical conundrums, if you will. Who gets prostate cancer? It's the old guy with low testosterone. It's not the young guy with high testosterone, okay? So that field gets kind of muddled and complicated. So you need somebody with a lot of experience who knows what they're doing, because anybody who's going to sort through that literature is going to see tons of contradictory information. And I read a book not that long ago by this guy named Yoho, and he was a emergency room doctor who became a cosmetic surgeon, and he's of a mind that bioidenticals are totally underprescribed. But like I said, that is such a complex area. And I say it's complex in the sense that there's so much contradictory information. You really have to spend a lot of time there to have that sorted out. So you'd have to go to somebody who really knows that. I don't know that well enough. And like, I try to read about it and I see contradictory paper after paper. So it's like, how do you sort that out? It's not that easy.
Hey, I'm having a problem here. Let me see, with my controller, and I can't control anything here. I can't, I'm not sure what to do. I can't click anything on my screen, on my computer screen. It's like it's locked.
Oh. Yeah, I didn't click on anything.
I can't even end this talk. I mean, there's nothing. I'm just, geez, I've never had something happen like this. I'm not sure if I have to like reboot my computer or something.
You can make 2 sessions of it if you want.
Yeah, yeah. Let me
It'll be Q&A part 1 and part 2.
I'll come right back on, Peter. I'm gonna just see if I can reboot here. No, it won't even let me do that. I'm gonna have to like unplug it. Hey. Okay, I'm back. So now where is Peter? Hopefully he's going to jump back in here. Let me see if I can make a few adjustments. Sorry, gang, for this technical issue. My computer updated last night, and I don't know if that caused something to happen. So do that. Let me text Peter. Saturday, November 5th. Okay, these are the questions. Got to tee them up again. Sort by newest. Boy, we got a lot of questions. B12, we did that. Probiotics, LPA, sauna, cooked mushrooms, microplastics, hormone secrets. I guess that is where we left off. Let me text Peter. Peter. Hey, come on back in. We're set to go. Just the same link that I sent you earlier. Yeah, it apparently didn't kill the thing's still running here. Yeah, it's right. No, I did too. I don't know what happened, but we're on live right now. So just click that link and we'll pick up where we left off. Are you in the room? Okay, enter the studio.
On the way.
All right, there you are. Gang, I'm very sorry. I don't know what happened, but thanks for hanging with us here. Maybe I can trim this out afterwards so people don't have to sit through it. The next question is, Dr. Rogers, do you know if it's absolutely necessary to have a mole removed from your leg if you run a lot in the sun? When these doctors remove moles from my running friends, they cut so much around the mole, leaving a huge scar, but everything turns out okay. Is that really necessary? Also, what's the best food to eat to get your A1C down as fast as 2 weeks? Is that possible?
Okay, those are two totally different questions. And really, you got to ask the dermatologist, whoever's removing the mole, what is the risk of cancer? The point being is the higher the risk of cancer, the deeper the excision is going to be, the longer it's going to take to heal, the more likely they might even have to cut through the fascia, and you might, be told you can't run for a while. So they're the only ones who know how much surgery they need to do. So you got to work it out with them. And, what's the risk of it? They'll look at it and based on its characteristics, so they'll be able to estimate the risk of malignancy. Then the second question is, how do you get your hemoglobin A1C down? Okay, the main thing that causes insulin resistance is high-fat diet. So you want to minimize your dietary fat, avoid all that stuff. But there's a whole bunch of secondary, less common causes of insulin resistance and increased type 2 diabetes risk. And that includes, omega-3 oils, all the omega-6 oils. Aluminum is toxic to the pancreas, so you want to filter your water, okay? Things that inhibit mitochondria tend to increase the risk of diabetes, so you want to avoid the mitochondrial inhibitors. MFG, get people to overeat, excess dietary salt on all the processed food, so zero processed food I would recommend. Things They also put succinate dehydrogenase inhibitor type fungal inhibitors in all the processed food associated with mitochondrial dysfunction. Because you talk about, what's the main cause of diabetes type 2? Saturated fat leading to inhibition of intermitochondrial membrane electron transport. So by that logic, other things that inhibit intermitochondrial membrane electron transport would likely increase the risk of diabetes. And a good example is a statin. Yeah, it lowers total cholesterol, but it also is an intermitochondrial membrane electron transport inhibitor, so it increases the risk of diabetes. So I would avoid all of that stuff. Alcohol causes fatty liver. Fatty liver is really diabetes of the liver, so I would say no alcohol, not one drop. High fructose corn syrup predisposes to fatty liver, not one bite of that. Glyphosate, sprayed on 70 different non-organic foods, especially on soy, they're all, associated with causing fatty liver. I would avoid all that stuff. I would avoid all those endocrine disrupting chemicals, estrogenic chemicals, because they're associated with obesity, which is associated with increased risk of type 2 diabetes. Okay, so all of that stuff pushes you in the direction. So I know the average person, you tell them all this stuff and they kind of give you this overwhelmed look and they're like, can't you just give me a pill? And I'm like, you don't get it. It's a blessing to have a list of 50 things you can go through and avoid, because what it means is that you're in control. That's what you want. You want to be able to control your own fate, your own destiny. That's freedom. That's opportunity. Okay. This idea of a magic pill, it's alchemy. Okay. It's fantasy land. That's what's told to people, but most of the time it's not true. Most drugs don't really work. They got a lot of side effects. Make sure you're getting your sleep, avoid sleep deprivation, avoid excessive stress, caffeine, because all those things cause hyperlipidemia. They cause increased cortisol, increased catecholamines, which drives up your blood sugar, which causes insulin resistance. So you want to minimize that. You want to get a lot of exercise. That improves insulin sensitivity. I would also recommend avoiding any type of SERCA inhibitor. That's a fancy word. It means sarcoplasm, endoplasmic reticulum, calcium ATPase, because those things tend to be associated with elevated hemoglobin A1C and insulin resistance. So, and what's a SERCA inhibitor? You hear this complex word. What does it mean? Just avoid anything that smells bad. Any chemical that smells bad, there's a good chance it's a SERCA inhibitor and it's bad for you. So don't smell pain. If you have to work with chemicals at your job, open the door, ventilate the area, that sort of thing. So that's basically it.
I also recommend a video I did on Aldara, which I learned about from John McDougall. That's for dealing with skin cancers, and there's research on it. And it's sort of, in some cases, it's what I do if I would have something on my face that had to be cut off, because when they cut on your face, you don't want them to cut on your face if you can avoid it. But you can. There's research on this. You can use Aldara, and there's a way you have to use it over time, and it creates a lot of inflammation and blistering and all that sort of stuff. And when you stop using it, that clears up, then you go back to the dermatologist. It's like, it's gone. It's not there anymore. And they've done, 5-year studies and so on to see recurrences. And it's a pretty interesting solution to some of the skin cancer things. We're of an age, or I am, where my dermatologist wants to see me every 6 months and, gets a nice payment for their condo in Hawaii or whatever it is, because they like to cut on people for sure. And so you want to have somebody that you trust, that you feel is not just looking to cut everything possible. That's my take on it. All right, next question is, please explain about HDL cholesterol. Keep being told mine 55 is good, but haven't studies disproved that all cholesterol is basically undesirable, and the lower the better, especially LDL. And then he gives his numbers: 158, 85, 86, vegan, no coconut products. I want my LDL about 50. Is that reasonable?
Yeah, I think HDL really doesn't matter. There's always going to be some lipidologist, making a video talking about all these nuanced things, because then they can sell you more drugs. First of all, they got to convince you there's a problem. And then once you believe you got a problem, then they can say, well, I've got the solution, buy my drug. Okay. So what I'm trying to say is, it just, like McDougall would only go by total cholesterol, with the goal of having total cholesterol below 150. And that's, I think, a pretty good way to go, because when you lower your total cholesterol, you're also going to lower your LDL. Those are the ones that are associated with atherosclerosis in a definitive way. I wouldn't sweat the HDL. Theoretically, the idea is that LDL is cholesterol being carried to the tissue, causing potential problems around the vessels. And HDL is, it's sort of theoretically, in a simplified way, being carried back to the liver, and it's the good one. Okay. But I think it doesn't matter. I really do. So I wouldn't just let it go.
And I think Jeff Novick, who's a dietitian that works the Pritikin he started out running the Pritikin program and then runs the nutrition side of McDougall's program for the last 20, 25 years, is also like people sweating these in small numbers. When you're eating the right way, you get a certain protection conferred. If your numbers aren't exactly here or there, kind of don't sweat it. I think that's his take on that. Here we go. I eat a plant-based diet, organic, lots of fiber. Sometimes I get constipated. I eat beans, oats, sweet potatoes, Brussels sprouts, all this fiber sometimes still can't go. I go to the gym 6 days a week, drink lots of water, no alcohol, no added sugar, oil. Please help. Constipation.
Yeah, for constipation, most of the time it's because they're not eating enough fiber. They don't have a good diet. There's certain foods that really sort of paralyze the gut, if you will, like especially dairy, the dairy protein. So that would include things like skim milk. So you want to make sure none of that you're 100% vegan. If you're eating all that fiber, most of the time things are going to be pretty good. You can also have side effects from medications like calcium channel blockers can really slow down the gut transit time. You can add some foods that are especially have a laxative-like effect, like you can eat a couple prunes every day or drink a little bit of prune juice. I've seen a paper suggesting high salt I'm not sure this is really true, but that can make constipation worse. Some people, if they're really chronically constipated, McDougall, for example, will give them a little bit of lactulose, sort of a mild diuretic or non-absorbable sugar. Really rare, a person can have a neurologic condition, things like a neurologic megacolon or something like that, or they could have a fecal impaction or something. But all that stuff's pretty uncommon in an otherwise healthy person. If you're talking about, an elderly spinal cord patient, that's different. Okay. But if you're talking about your typical kind of person who sends questions to these internet question sites, these are outpatient walker talkers that are interested in their health. Okay. So they're pretty unlikely to have all that. So that's basically what I'm saying. Optimize all this diet and stuff. And if you still haven't resolved the problem, maybe you do have a real intrinsic problem with your colon and maybe you need a colonoscopy, but I would go see a gastroenterologist if things don't resolve just by improving the diet like we talked about here.
Great. Next question is, for millions of dollars, would Dr. Rogers eat one block of organic non-GMO tofu, one avocado every week for the rest of his life? Okay.
No, I wouldn't mess around with stuff. It's sort of like you only get one body, one life. It's like having a car that has to last you. You're going to go for 100 years. Let's say you're going to go for 90 years. All right. You only get that one car. It has to last you. If you mess it up at all, then that's it. Okay. It's not always that easy to repair the car. In real life, you can get a new car, but in human life, your body, you can't get a new body. So it's wise to be as careful as you can be.
Great. I have wet macular degeneration. Recently discovered I have blood clots on lungs. Do you think there could be a connection, both being vascular problems?
Yeah, I think they probably are connected. Almost all the common vascular diseases, they're all common eye diseases. They're all vascular. Age-related macular degeneration is vascular, glaucoma, hypertension, diabetes. It's all vascular. So you want to minimize all your risk factors. And again, I think one of the most useful things you can know is that atherosclerosis is a blood clot. So if you don't want atherosclerosis, avoid everything that predisposes the blood to clotting, which means the high-fat diets. It also means anything that causes leaky gut, because at leaky gut, you then get the bacterial endotoxins into the blood. They change the shape of the fibrinogen, and in so doing, it becomes much more prothrombotic. Okay, you get these so-called amyloid clots, fibrinolytic clots. Douglas Kell and Atherese Pretorius have written the most about that. Okay, so I tell you about that because that's a way to reduce clotting and protect yourself from atherosclerosis. Because those little clots, those fibrinolytic microclots, they travel all over the body and they start plugging things up. They increase the risk of AFib, they increase the risk of dementia, and they probably also increase the risk of, loss of eyesight. So I would want to avoid that. I'd recommend, I've given lectures on this before. I got one here at the Veg Source channel. I think it was on one of my autoimmune lecture, where I went through all the things that cause leaky gut. I got a list of about 25 things. I would avoid all that stuff. And what is it going to be? It's going to be things like filter your drinking water. The fluoride increases your risk of leaky gut. The aluminum increases your risk of leaky gut. High-fat diets increase your risk of leaky gut. Oils increase your risk. Alcohol increases your risk. So you want to avoid all those things. And then the emulsifiers, the processed food, all of that stuff. so that you'll be less likely to have blood that's prothrombogenic. That's pretty much the main stuff to watch out for. And I would avoid mitochondrial inhibitors, okay? Everything in your body, in order for it to function, it needs good blood supply and it needs good mitochondrial function. So I think that's a fundamental gap. I found over 100 mitochondrial inhibitors. They're not in any of the biochem books. You can only find them from digging around in the medical literature. I would avoid all of them. I gave a lecture here just a couple months ago where I went through all the mitochondrial inhibitors. And I talk about that in my AFib lecture. Okay, so I would want to avoid all of those. Okay, so what you're doing is basically what it comes down to is, are the cells in your eye working? And the cells in your eye have a lot in common with the other cells in your body. They need oxygen delivery. They need good mitochondria. So how do you give that to them? Avoid mitochondrial inhibitors, eat a low-fat diet, low-sodium diet. And then the reason why you want to manage your stress, get your sleep, and avoid caffeine is all that contributes to hypertension, hyperlipidemia, insulin resistance, and diabetes, okay? So it all gets connected. So that's basically what I'd recommend.
Okay, next question. How does a man avoid and treat an enlarged prostate?
Yeah, the prostate's a bit of a nuisance, isn't it? A lot of times, we're not aware of it until it starts becoming a bit of a problem. And the big thing for guys is, there's going to be a delayed onset of urination compared to when you want it to happen. It's like you got to ask your wife for permission. Also, a big thing for guys is you get woken up a lot at night to void because you have less bladder volume that it can handle. Estrogenic chemicals are associated with enlarging the prostate, so you'd want to avoid all those things. Hopefully you can get it under control. People have different supplements they'll consider taking, different medications, and maybe you'll need that. That's sort of a last step option to avoid surgery. Some people go for surgery, but what I found is I had noticed a big prostate like about 25 years ago, and I started then becoming a vegetarian, eating healthier, and all that stuff went away. It just stayed the same. It never got worse. You want to avoid dairy. Dairy is associated with increased risk of prostate cancer. It's associated with, these other prostate problems. It's often highly estrogenic. I also think some people have what I would call micromercurialism, meaning from dental amalgams, the mercury, that contributing to having to wake up more often at night to void. Also to sleep better, I go through all the sleep hygiene stuff, meaning that you want to see a bright sunlight when you first wake up in the morning, or at least a bright light in your house to sort of set your circadian rhythm for your wake up time. And then at night, you want to avoid the blue light because the blue light is how your brain perceives daytime. You've got photoreceptors in your eyes and your brain. That blue light means daytime. And the point I'm getting at is you're not going to start making melatonin, the sleep hormone, if you will, until that blue light is reduced. So if you're looking at blue computer screens and cell phones and bright lights in your house, because nowadays they sell mostly blue LED lights, you're going to have a hard time sleeping. And if you can't sleep, then that's going to really be detrimental to your health. I had some problems sleeping, and what I did was I started going through all this stuff to improve my sleep. My sleep still isn't exactly the way I want it to be. I've had a little bit of problems with that, but you want to do everything you can in your power to improve your sleep because your brain cleans itself when you're asleep. Your body heals when you're asleep. So if you want to be strong, vigorous, and, clear-headed, you want to try to optimize your sleep. So that's it. I mean, like I said, you can talk to a urologist and take some medicines if you have to, go for surgery if you have to. But by optimizing all this other stuff, you can delay the likelihood that you'll need to take surgery or pills.
All right. What is your opinion on creatine supplements?
Yeah, I think they're a bad idea. It's like anything that's this is $1 billion commercial product. It's going to get lots of hype. You go to all these, because I took creatine for a brief amount of time, about 20 years ago, for exercising and lifting weights. And I was sorry that I did it. When you go to all these websites where they sell it or promote it, they're going to tell you how wonderful it is. They'll say no proven problems with kidney failure, no proven problems with increased cancer risk, no proven problem with increased tendon tears. But then you go to the bodybuilder forums where the individual bodybuilder guys start talking to each other, writing their own comments. And they'll be like, this stuff put me into kidney failure. I ended up on dialysis, increased risk of tendon tears. I think I had a mild rotator cuff tear because I did it only for a little bit of time. And then also it's a powder. I will never eat anything again that's a powder once I started going through all the contaminants and powders. Consumer Reports has a bunch of stuff about protein powders being contaminated with heavy metals. Lead Safe Mama has a bunch of stuff on foods contaminated with heavy metals. And then it wasn't just the protein powders. It was all these other spices and stuff. I will never eat anything that comes in a powder form. It's just routine that somehow heavy metals are getting in there, maybe because they want it to weigh more so they can sell it for more and make more money, that they end up being contaminated. So I would not mess around with creatine. And I've seen bodybuilders, guys with 3 different types of cancer in their 40s. And I don't know for sure if it was the creatine, but I would read also, I bought a whole book of research studies on creatine because I wanted to understand it. And I would read in the conclusion, no proven incidents of, kidney failure or cancer. But then I would go into the middle of the body of the paper, and they would say, here's the metabolites that are associated with increased risk of kidney failure. Here's the metabolites that are associated with increased risk of cancer. So I just felt it was, one of these overhyped things. It's theoretically a way to potentially have more ATP energy in the muscle. But bottom line, I wouldn't risk taking that stuff.
All right. Well, I think you sort of covered this one. Why does LDL go up after menopause without change in diet lifestyle? If I can't get under 100 through diet, should I take low-dose statin?
Again, I would optimize diet and lifestyle. They don't know for sure why it goes down. I've read about that in the past. I think it might be related to lowering, the estrogen levels coming down, but I'm not sure anybody knows exactly what it is. But I would just still optimize all that health stuff. There's a lot of postmenopausal ladies running around pretty healthy and vigorous, like Ruth Heidrich was doing all these long runs and triathlons. I'm not saying you need to do any of that stuff, but what I'm trying to say is just because a woman's postmenopausal, she can still be pretty energetic, fit, and look good. If worse comes to worst, maybe you could go down that estrogen path, but I would try to do all the other stuff first. I would not jump to medicines or pills. Not in the beginning, at least. No way.
Great. Thoughts on consuming fresh made carrot and other vegetable juices daily as part of the McDougall type diet?
Well, it's better to eat the food rather than, put it into a blender. I think it was Dr. McDougall who said, you don't improve a food by, smacking it with a metal blade 1,000 times. I mean, you could eat the blended smoothie or whatever, but why not just eat the regular food?
Yeah, my wife, after she went into liver failure, which you helped us figure out what it was from an herbal tea that she was drinking that had injured her. And when she stopped that, it went away. She was juicing beets every day for some months and felt that really accelerated her healing. So maybe for certain, specific things, I don't know. As a daily thing, I don't drink my calories myself. Yeah,
the only thing too I would say is those blenders are kind of loud. So I'd make sure you're wearing ear protectors, and so you don't go deaf. Beets, they got a lot of nitric oxide precursors, and that's thought to vasodilate you and increase your energy level. I know that if I drink beet juice, I have more energy for working out. So for what that's worth.
All right. Dr. Peter Rogers, will you ever do live streams on your own channel, and will you get a Zwift bike and race people like Skeleton City?
A Zwift bike, that's like one of those stationary bicycles. Nah, I like a treadmill better than a stationary bike because I can read when I'm walking on a treadmill. As far as doing live stream or any of that stuff, my YouTube channel is kind of a miracle that it exists. I work full time in conventional medicine. I really don't have much free time, and I'm actually not that good with computers. I don't edit my videos at all, zero. All I have is a webcam. I don't even know how to make a short. So I don't see myself doing live stream. I'm kind of ostracized from the whole vegan community, which is mostly what I would call high-fat phonies. I'm in the separate school of veganism. I'm in the low-fat veganism, sort of from Kempner and McDougall and stuff, and Jeff Nelson, Vegasource and stuff. We're the low-fat fanatics. Okay, the high-fat phonies don't invite us to anything. So anyways, I don't see myself doing any live stream or any other fancy stuff anytime soon. I'm sort of just trying to keep it afloat with webcam videos. So
the low-fat fanatics are the ones who did all the research that got everybody's attention and made everybody like Dr. Greger go, wow, this is a great diet. And then since then, the newer people come along and they drift into what you call the high-fat phony phase, but the guys that really made an impact and proved up what they did, those are the low fat guys. All right, next is, as you probably know, there's recent good research suggesting that stents for heart arteries don't protect from heart attacks, though they do a better job of dealing with pain than meds. I know there is also research which justify the more liberal use of stents. What's your reading of the research?
Yeah, so basically, imagine this is your heart, and imagine this thing is your heart right here, this ear protector, and then the hand on top of it, those are the big coronary arteries. So those will be the epicardial coronary arteries on the outer surface of the heart. Those are the ones that everybody's heard of. The left main coronary artery is the widowmaker, then the left anterior descending is the big one in front, the left circuit on the side, the right coronary on the other side. Okay. That's where you can have a focal blockage, and they can come in there with a catheter and put a stent into it. And, that's nice. Okay, you can decrease cardiac angina. That's what he meant by decreasing chest pain related to the coronary arteries. However, there's been some pretty important papers. The most important one would be the one by William C. Roberts. Okay, he did autopsies on thousands of patients that died of heart attacks. And he said that the traditional conventional idea of single vessel coronary artery disease, it doesn't exist. It's a myth. That the coronary artery disease, meaning the atherosclerosis, was always diffuse, meaning it was present always, no exceptions, throughout the coronary arteries. He divided them up into 5 millimeter segments and then measured the amount of stenosis and atherosclerotic plaque at each level. And he said it was always of similar severity, diffuse. It's a systemic disease. And what that means is you can't put stents all the way up and down the coronaries. And even if you did, you would block off all the branch arteries, and you would not, open up the intramyocardial, intramuscular penetrating arteries. You just can't do it. So whenever you have a systemic problem like that, the treatment has to be a systemic treatment, which means it has to be one of two things. It's either going to be diet, or it's going to be pills, or it's going to be both. And diet works much better than pills. So why wouldn't you do that? And we know what diet works. From all the data, Kempner reversing EKGs, Pritikin reversing EKGs, McDougall reversing EKGs, Ornish reversing coronary artery on SPECT scans, Esselstyn reversing coronary artery, even on, arteriograms. And McDougall saw some arteriograms also of reversal of coronary artery disease. Animal studies show the same thing. Blankenhorn's work shows the same thing. By minimizing dietary lipids as much as you can. That's what's been shown to work. So that's what I would do, because that's the only way you're going to diffusely prevent it, because they can only stent, they're going to stent, let's say, a 70% or more stenosis. Those aren't the ones that typically theoretically rupture the vulnerable plaque that causes an MI. So what I'm trying to say is that cardiac cath, they can't even see the plaque that's most likely to rupture, so to speak, and cause a heart attack. A heart attack is like a sudden occlusion of the coronary artery where it acutely thromboses after plaque rupture. So what I'm saying is, you're not going to reduce the incidence of heart attack just by putting stents in. So that you're not going to make the patient live longer. You can improve their exercise tolerance if you got a focal fixed stenosis, but they're pretty overrated. You get about $30,000 a piece for stents. For teaching the vegan diet, you get hardly anything. So there's no institutional support behind the low-fat vegan diet. It's basically an orphan therapy, and it's always going to be an orphan therapy because it doesn't serve the interest of big money. There's no hospital corporation that's ever going to want it. There's no drug company that's ever going to want it. There's no insurance company that wants it either. McDougall negotiated with the insurance companies to try to see if they would accept him bringing patients in for a couple of days to train them in a low-fat plant-based diet. And the insurance companies refused. And they told them between the lines, they said, look, the higher the premiums the patients pay, the more money they make. So even for the drug company, the insurance company, there is no interest in low-fat vegan diet because they lose money on it. The drug companies lose money on it. The hospital lose money on it. So none of them want anything to do with it. And that's also why I said there's only one thing that could save healthcare and make it dramatically improve, and that would be Christian ethics. That you put that patient's value, like a mama and papa for their baby, more important than money. And they're never going to allow that. So it's never going to be fixed. And that's just how it is.
Lovely. All right. Thoughts on an occasional 100% alcohol-free beer? They are supposed to be guaranteed no alcohol at all.
My attitude is like, why would you want to poison yourself? Okay. So it's sort of like the average person, they look at this low-fat vegan diet as a burden placed on them. Oh, why do I have to eat this? Well, I don't want a heart attack. I guess I better do it. And for me, it's like all day long as I see train wreck, disaster, cognitive decline, stroked out, just, pathetic people that you really can't do that much from. And it's sort of like, I don't want to end up like that. Okay. I studied tons of writers and these other great academic scholars and stuff. And, they often start developing a lot of atherosclerosis by their 60s and 70s. And they're no longer capable of doing significant intellectual work or writing or anything. And they're like, I don't want that to happen. And the only way you're going to prevent it is keep your arteries open. So I want to do everything I can to keep my arteries open. I don't want to eat any junk food. Why would I poison that? It's like, I think today I'm going to put some junk in my gas tank. Why would you do that? No, I only want to eat good food. I have high intellectual goals for myself. I got, 3 books in my head that I want to write. I just got to find the time. All right. I got a lot of other things I want to do. Why would I want to poison myself? Okay. I look at processed food as just metabolic poisons. Why would I put that into my body? If I have a choice, I never would.
Terrific. So how do you manage to eat enough calories? Only eating 1 meal per day. You must be eating close to 2,000 calories.
Yeah, just eat more food at that time. So, I work all day. Then I come home and I'll eat what I call the OMAD diet, 1 meal a day diet in the evening. Okay. And I have no problem doing it. Sometimes I'll watch a video. Sometimes I'll listen to an audiobook, talk to my girlfriend or something. I have no problem doing it. I've done it for decades and it works just fine.
Next question. What's a way to deal with receding gums?
That's a tough problem because it's hard to get them to grow back. There's some things that seem to make it worse. You don't want to be too aggressive with dental floss. Okay. First of all, you want to use the old fashioned floss. You don't want those hyper smooth glide ones because they tend to have Teflon and other stuff on them. You don't want PFAS and all that. But you don't want to be cranking too hard with that dental floss because it smushes your gums. You're pushing the gums down. You're causing receding gums when you do that. You want a soft toothbrush. Those hard toothbrushes, they can also sort of push the gums back and worsen that problem. You want to take good care of your teeth in general. Avoiding the sweets, avoiding the acidic foods, the soda pop and all that, because that'll also make you less likely to have cavities or other dental problems. And that's about all you can do is just try to optimize your dental health because it's hard to get those gums to grow back. And as the gums recede down, they start to uncover lower and lower parts of the tooth. And on the upper top part of the tooth, the crown, you got all that enamel, which is hard and relatively protective against cavities. As you come down low, you're mostly in the dentine, not much enamel, so to speak, just cementum around it. And that isn't able to defend itself, so to speak, as well against cavities and acid. So, yeah, that's about what I can tell you. I don't think there's any great way to grow gums back. There's some dentists online will tell you they think they grow back a little bit, over time if you maintain good dental health. So that's what I would do. But there's no easy, quick fix that I'm aware of.
Great. Next question. What foods should I eat to get rid of harmful parasites?
Well, I would say you first of all need to know what you're dealing with because just, the word parasites, that's a big umbrella category. You'd want to precisely know, are you dealing with a tapeworm? Are you dealing with a ringworm? Are you dealing with, some other amoeba or something? So you got to figure out what type of parasite it is. Maybe you need to do a stool culture of some sort. So you'd have to see a gastroenterologist, preferably one with some familiarity, like with tropical diseases, for example. And then based on that, you could decide what type of parasite it is, and then what's the antibiotic or other treatment routine recommended for it. So I would figure out what specifically it is to be sure that you actually have a parasite. Because sometimes people just say, well, I think I've got parasites. Well, how do you know?
Next question. How harmful is it for the human body to take pharmaceutical drugs? Obviously it depends, but.
Yeah. That's a giant open-ended question, And I would basically say the best drugs are when you replace a known thing. Like if you're type 1 diabetic, you need insulin, okay? And you replace that insulin, you're okay. That's a good drug, all right? But a lot of other drugs are really just marketing, It's like, nobody would sell amphetamines to children unless it was very profitable, okay? If it wasn't very profitable, it wouldn't be a recommended treatment, if you know what I'm saying. So the big profits get involved in what gets recommended. I think it's insane to give amphetamines to kids. Label them with this disease, hyperactivity, call it attention deficit, and now all of a sudden you're giving amphetamines to children. That has long-term neurologic consequences, not good. So I would just say you don't take a drug unless you absolutely have to.
So Dr. Rogers' papers on PubMed regarding stem cell injection therapy look amazing. Can you research and let us know what you think about it?
Well, everything when it first comes out, they tell you it's amazing. It's the greatest thing since sliced bread. They overhype it. Okay. They always do. That's how they sell it. It's a business. I think that's also a fundamental rule I would tell people is stop thinking anybody cares about you. No one cares about you. No one likes you. No one's doing anything to help you. You need to get that through your head, because if you don't, if you approach the healthcare system thinking it's designed to help you, you're going to get chumped left and right. It's a business, okay? It sells drugs. It sells imaging tests. It sells, blood lab tests. It sells procedures like colonoscopy. It sells surgical procedures. That's what it does. That's how it makes money. It runs patients through like an assembly line, like widgets, okay? That's what it's designed to do. It's not designed to care about you. It's based on atheistic Darwinism. I just tell you all that because people always get their hopes up. Like I've seen diabetics who won't change their diet because they read an article about some new magic drug that's around the corner that's going to save them. Okay, and also the stem cell. What is that? Okay, what I mean by that is, where are those stem cells coming from? Are they coming from adults? Are they coming from a laboratory cloned culture? Are they coming from aborted fetuses? I think some of this stuff is crazy. They abort a fetus, chop it up, make it into medications. People take those medications. As far as I'm concerned, that's cannibalism. It's like child sacrifice to Moloch, okay, for money, to worshiping the god of Moloch and Mammon. I'm telling you, some of it is sick, okay? So I would just be real careful about it. I would spend a long time looking at it. And any new therapy, it usually takes a minimum of 10 years to figure out if it really works and if it's safe or not. And quite often it takes 20 or 30 years before they really figure out how bad something is. Like a lot of these selective serotonin reuptake inhibitors, like Prozac, for example, major neurotoxic substances. Okay.
Okay. Here's another B12 question about how they can be measured in different ways. And all believe we need to supplement it. However, we never hear anything about that. Can you explain the research behind B12? I mean, we did talk about B12.
Yeah, we kind of covered B12.
You recommend avoiding nonstick pans. Teflon is probably not good. How about the ones using ceramic nonstick coating like green pan? Claim to be
free. This is funny because it totally reminds me of teeth. Okay. So people started wising up. Oh, the regular silver fillings are actually 50% mercury, and mercury's neurotoxic, and it's toxic in other ways too. So it's toxic to mitochondria, it's toxic to the kidneys, it's toxic to everything. All right, so anyways, they go, well, we don't want that. So, okay, well, instead of putting these silver mercury fillings in, we're going to put in ceramics or composites. And doesn't that sound beautiful? But then you look a little closer, and the dental people will tell you, well, if you just put in something that's purely plastic or similar to it, it's not strong enough. It wears down too fast. So you have to strengthen it by making it an alloy, combining it with something else. So what do they combine it with? Aluminum. Aluminum oxide, okay? So the funny thing about it is, it's the same thing with these non-stick pans. They say, okay, we're not going to use the fluoride, Teflon, PFAS. Well, they're going to use aluminum. They use aluminum, okay? Recycled aluminum. That's what that so-called green pan. Green, calling it green makes you feel safe and happy. You get a warm feeling inside when you say, oh, my cookware is green. But it's made out of aluminum, okay? Aluminum is a major neurotoxin. It's a gut toxin. It causes leaky gut. It's toxic to your gonads, decreases testosterone, decreases sperm production. It forms complexes with fluoride, increasing traversal of the blood-brain barrier, and it kills brain cells. It inhibits plasma membrane calcium ATPase, so it's an excitotoxin. It inhibits the circle pump as well. It's a toxin to mitochondria. So, I don't think you're going to win that game with nonstick cookware. I'd avoid all that stuff.
Okay. We've got, is indoor wall paint safe? I mean, living in after it's dry.
Yeah. I mean, what you're talking about is the idea of VOCs, volatile organic compounds. So something that transitions from being a liquid to a solid as it becomes solid, as it dries. This would be like liquid paper, glue, these other paints and whatnot. some of these cleaning chemicals, they give off volatile organic chemicals, which often smell bad. So those things are toxic. All right. They can increase the risk of asthma, increase the risk of autoimmune disease. But, once it's all dry and it's not giving off a smell, it's probably not a big deal. All day long we go around in buildings with old painted walls. I mean, the worrisome thing would be, you want to make sure the paint's not lead paint or something and it's cracking and the dog or the kid could eat it.
Great. Next. Thomas Weems claims high-carb diet is the main reason for kidney disease, not overconsumption of protein. He claims all science backs us up and there are no good science proving connection between kidney problems and protein. Are you familiar with him? What would you say?
Yeah, I don't think that's correct, okay? Because, carbohydrates don't have nitrogen in them. It's elevated nitrogen intake that's associated with kidney failure. So you get elevated BUN, you get uremia, okay? The people who eat, the high carbohydrate, starch-based diet, that protects their kidney. And I know that guy. I've seen some of his work. He's a big promoter of the ketogenic diet. I think the ketogenic diet is a big mistake from the get-go. It's high in meat, high in animal protein, high in fat. I think it's medically incorrect, okay? You're putting a big burden on your kidneys. When you eat animal products, you cause a systemic inflammation. The kidneys go into hyperfiltration, which is like working a triple shift around the clock. You accelerate the rate of kidney failure in your diabetics and your other kidney failure patients when they're on high protein diets. That's pretty well known. Go ahead, go watch all the nephrologists. I wrote a book about kidney function, okay? And go study all their work. There's nothing good about high protein diets for the kidney. It's the opposite of what you want to give to a patient with kidney problems. High fat too, because it's atherogenic. You're plugging up the arteries of the kidney, then it can't work. Kidney to function optimally should have good blood flow. Why did Kempner specialize as a nephrologist, internal medicine internist and a nephrologist in protecting the kidneys? And what did he say? He was proud. He said, my diet is the lowest in fat. My diet is the lowest in protein. My diet is the lowest in sodium. And that's why he had the best results for protecting the kidneys and lowering hypertension, which is a major risk factor for kidney failure.
Okay, this is on your video about women getting lung cancer. Your slide contained text about radon being a scam or something, but you never said anything about it. What did you intend to say?
Yeah, I studied radon a long time ago, and sort of the feeling that I got was it was totally exaggerated. It was good for the economy. If everybody needs to, redo their basement, there's a lot of money in that, but it seemed like it was pretty exaggerated. I actually was into it for a long time. I haven't studied it in a long time, but I bought equipment to try to test for it and stuff. And the impression I got, the more I read about it was an exaggerated thing. I mean, there's a little bit of a problem there, but I don't think it's that big of a problem.
Next question. There's a YouTube dentist recommending xylitol as a replacement for sugar. She not only claims it will prevent cavities, but also fix all your dental problems.
Yeah, if only. Just chew this magic gum. Okay. Well, number one, a lot of people got dental amalgams or aluminum oxide composites, ceramic fillings and stuff. When you chew a gum, you dramatically increase the amount of mercury that comes out of those amalgams. So that's not good. The next thing about xylitol is it's prothrombotic. It increases platelet activation. So it increases your risk of forming blood clots. Okay. I think I saw one paper. It's associated with increased MACE, and the MACE was the abbreviation for major adverse cardiac events. It's prothrombotic. All those artificial sweeteners are bad. I would stay away from all of them.
Okay, foods that increase triglycerides.
Yeah, if you eat high-fat foods will increase it. Simple sugars will increase your triglycerides. High fructose corn syrup will cause fatty liver and lead to more triglycerides. So those are some of the main things that'll do it.
Which has more benefits, sitting in an infrared dry sauna or sitting under the sun fully dressed until you sweat?
That's kind of a funny question in a way. It's almost like saying, who would you prefer to sleep with, a woman or with a blow-up doll? And you're like, at first, it's obvious. A woman's the natural thing, Then you say, well, gee, the blow-up doll, it's not going to lie to me. It's not going to cheat on me. It's not going to get mad at me on her period, every month for a couple of days. But anyway, so what I'm trying to say is the sun is natural. That's what we're made for, okay? It not only gives us vitamin D, it also increases nitric oxide precursors. It also improves mitochondrial function. And there's other health benefits too. The patients heal better. Maybe it improves immune function from tuberculosis and whatnot if they put them on the sunny side of the hospital, if they give them some time outside. And so I know there are a lot of people, credible people too, who say good things about saunas, but I'm just not convinced I would go there because I worry if there's going to be some subtle delayed negative effect from heating up too much, just like we worried about, heating up a kid too much with a fever. We're worried about when they get over 104. So that's why I haven't gone down the sauna pathway. Like if I want to sweat, I like to sweat because your sweat glands are like little kidneys. And they do filter out heavy metals, including arsenic, including mercury. So it's good to sweat. When I go exercise, I wear extra t-shirts and sweatshirts, so I'm going to sweat a lot. Yeah, so I guess what I'm saying is go out in the sun. That's what we're made for. That's the natural thing. That's what our bodies are programmed to work with. The sauna, it might have some benefits, but I would study that more. Maybe not having it so hot. You can walk in the desert in 120 degrees, but there's nobody hangs around in 180 degree temperatures.
Any nutritional or health info you've changed your mind about in recent years after more data, reading, or experience?
The only big thing I've changed on I can think of in the last couple of years is I sort of made a little bit of a reversal on this water pick thing. And I'm not doing it with 100% certainty. I like the water pick. I was happy with it. It's a convenient way to clean out your teeth real fast. And it's a reminder to rinse your mouth. But I was worried because the guy who gave me this article was a viewer who contacted me. I think he had a good point. He says the water sits in plastic for who knows a variable amount of time, and it pushed through plastic tubing at high pressures. That's probably going to cause microplastics. And he's probably right. He didn't have definitive proof of it. I don't have definitive proof of it, but the logic seemed reasonable. You look at the risk-benefit ratio, I don't gain from it. I can just rinse my mouth with water. I can just floss with old-fashioned dental floss. So that's what I do. And then I brush with a soft brush afterward to get the biofilm off the teeth. So I changed on that. Is there anything else big that I've changed on? Not anything big that I can think of. No.
Great. So since fasting is so beneficial, then doesn't it make sense that our bodies really don't need much food to be healthy, nor a big variety either? McDougall said to just eat potatoes. Is that enough long term?
Well, there's a couple questions built into that. Basically, I'm doing the one meal a day. So most of the time, my body's not processing food. And some people say, well, there's advantages to that. But then other people say, there's always some little bit of a counter argument. Well, if you eat at night, then you're sitting around sleeping and your body has to deal with all that food at night. Well, okay. I don't like to eat breakfast because if you eat breakfast, number one, you got to wake up earlier. Then you don't get to sleep as much. And your best brain time is in the morning because the brain cleans itself overnight through the lymphatic system. So that's why I don't like to eat breakfast. I don't even like to eat lunch. So I'm just freed up. That's all my good intellectual time. And then at night when I'm kind of tired and your brain doesn't work as well at night anyways, that's when I like to use for food. It's like the Roman soldier diet. They ran around and did stuff all day long. And then when it was dark, made a fire, cooked their food, ate their dinner, and went to sleep. So I think a little fasting in that sense can be okay, but I think fasting kind of gets overhyped. I believe it has a therapeutic benefit. You got some patient newly diagnosed with cancer or something, get them over to True North, fast them for a couple of days under supervision, or you got some big, really fat person who doesn't have good willpower, they're not willing to read, send them out and do that, okay? But I don't think, you're not going to win the game. You have to every day get your calorie load, so to speak, and you're going to have to eat. So I think fasting has its place, but it's not an everyday routine thing. I don't think it's going to do that much good. What you eat on a routine basis is what's going to determine your health. A fasting here and there can have benefits, like I said, for an acute cancer patient or a patient that needs help turning the corner, but you got to eat. So eat good food.
So next question, now that Athea Hayes' book and expose of the vitamin and mineral supplement industry is out called The Enigma of Vitamin B12, Nature's Only Mistake, has your view on vitamin and mineral supplements changed?
Yeah, we've covered enough B12 for today, I think.
Okay, all right. If someone was just diagnosed with Hashimoto's and thyroid number is only slightly elevated, can that be reversed with food or important to go on levothyroxine? However you say that.
Yeah, I would try to, fix the diet and lifestyle first. So what you would do is say, well, what causes, Hashimoto's? It's thought to be primarily due to leaky gut, leading to autoantibodies. So I would avoid everything that causes leaky gut. There's about 25 things. We talked about some of them already. Filter your drinking water. You're going to have to use reverse osmosis in your kitchen, or you could use distilled water, but I like reverse osmosis to get the fluoride out, to get the aluminum out. Okay. You want to reduce those estrogenic chemicals. They're thought to increase the risk of autoimmune disease. Okay. And then you want to avoid oils. You want to avoid alcohol. All right. You want to avoid bromines, which means avoid flame retardants. So you don't want flame retardants on your furniture. If you're in the medical profession and you're doing a minor procedure, just wear a yellow gown or a white gown or something. You don't need the blue gowns, which are for the operating room when you're working with cautery, so they got flame retardants in them. Things like that. Try to add up all these little steps if you can. If you own a swimming pool, maybe don't swim so much in it for a while. See what happens with that, especially if it's bromine, sanitize the water. Let's see, what else could you do? I would go through all those lists of everything that's harmful to the thyroid, I would avoid cruciferous vegetables because they're a little bit goitrogenic. Okay. I would avoid soy. Soy is goitrogenic. Flax is goitrogenic. I would avoid all that stuff. I realize they're probably minor contributions, but I want, you're just trying to buy a few percentage points so you can stay off a drug. That's what I would do. I would try to optimize all that stuff, and it might help you. And then I would avoid anything else that can cause leaky gut. So I would avoid all that, all those volatile organic chemicals, VOCs, because those can cause leaky gut as well.
Well, Peter, we've been going for about an hour and a half. I think we're going to stop here for today. And I want to thank you for hanging out with us. And Dr. Rogers, thank you, as always, for your insight, your honesty, your humor. If we did not get to your question, and it looks like there's a lot we haven't gotten to, one thing you can do is to get in faster to post. And the best way to do that is to subscribe to my Substack so that you'll get an email just, calling for questions right when it goes out, and then you can get in immediately. Guys, thanks again. Like, subscribe, and have a great weekend. We'll see you guys soon. Peter, thank you again. Take care.